Stress, the pandemic, and the winter blues. How to support people suffering from substance use disorder cope with the emotional triggers brought on by the winter season and the pandemic. Welcome to Advancing Health, a podcast from the American Hospital Association. I'm Tom Hetterly, Executive Speechwriter for AHA. In this week's episode, Marie Cleary-Fishman, Vice President of Clinical Quality at the AHA Center for Health Innovation, is joined by Debra Houry, MD, MPH, and Director of the National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention. They discuss navigating the opioid epidemic amid the emotional triggers brought on by COVID-19 and the post-holiday winter blues. Seasonal effects such as hibernation and loneliness can lead to a gloomy outlook and make people feel hopeless. Hospitals and health systems can proactively identify patient needs and offer solutions to avoid increasing usage of opioids and other substances in their communities.
Well, welcome, Dr. Houry. Thank you for joining us today to discuss how hospitals and health systems can support people suffering from substance use disorder during these unprecedented times. Could you start by letting us hear a little bit about your role at the National Center for Injury Prevention and Control at the Centers for Disease Control and Prevention and your work to address substance use disorders?
Sure. Well, and thanks so much for having me on this podcast, Marie. So I serve as the director of the National Center for Injury Prevention and Control, also known as CDC's Injury Center, and I'm an emergency physician who works in an affiliated opioid use disorder clinic. At the Injury Center, we try to take a public health approach to injury and violence prevention by really focusing on science and using that to drive action in order to prevent injuries and violence from happening in the first place. And in our center, we're focused on three urgent and related public health issues: adverse childhood experiences, overdose, and suicide, because they're so intersecting and really impact each other. In our center, we have a division of overdose prevention that focuses on using this data to drive action by monitoring trends, supporting clinicians, health systems, and clinical practices, and really increasing public awareness around this evolving epidemic.
That's fabulous. I love the focus on science driving intervention, right? That's so important. And especially in these times today, we're hearing so much that we need to go back to the basics. So that's fabulous. Can you talk a little bit about how COVID-19 has impacted people who are either currently in treatment for a substance use disorder or those in recovery? What have you seen?
So I think, COVID-19 has certainly impacted all of our lives, and it creates certainly challenges for people who are currently in treatment. Oftentimes, particularly early in the pandemic, some in-person treatment options might not be available or might have been disrupted, which could lead to untreated substance use or substance use disorder, or to a return to substance use for people who were not currently using or had been in recovery. And I think the other issue with this pandemic is for those who are currently using drugs or return to using drugs, we know that there are disruptions in harm reduction services, and there's changes to the drug market as well. So if syringe service programs are closed or have restricted hours, this limits access to clean syringes and access to care. And with changes to the drug supplies and drug market, there might be contamination to drugs, and so people might be using substances that they're not used to. And then even with the public health measures we're putting in place to protect people, like physical distancing guidelines, or in some cases stay-at-home orders, this might lead to people using substances alone, in which case there's not somebody near them to call 911 or administer naloxone.
Wow, those are really impactful kinds of things that we need to be dealing with. Are folks who are struggling with substance use disorder at any increased risk of COVID-19 and the adverse outcomes that we're seeing? Are you seeing that?
So what I would say is we don't have the data to say that that's for sure, but when you look at what drug use, the impact it has on different effects on the body, we know the use of drugs by smoking or vaping, like heroin or marijuana, can make lung disease, like chronic obstructive pulmonary disease, worse. And when you use alcohol or other drugs, it might alter judgment and make it more difficult to practice COVID-19 safety measures. And then there's also certain conditions that affect the immune response, such as HIV or liver disease. And this is often more common among people who use drugs, especially among those who are injecting drugs. So it's possible that drug use could make COVID-19 illness more severe, but we need more evidence and more research.
Understood. Yeah, thank you. That's important. So one other question I have around the stigma. Frequently, people who are struggling or dealing with a substance use disorder may be more reluctant to seek medical help. Are you seeing that related to COVID-19 either as well?
So I think whenever there's issues around stigma, it can delay, seeking medical treatment. I know in the emergency department, many of my patients wouldn't want to disclose whether it was violence in the home or, drug use because of, worry about stigma. So I think we don't, again, know who's not seeking care, but we do know during COVID, people are less likely to seek care even because of worry about infections,
Sure.
leaving the home or going to emergency departments. I do think, we could presume that, again, due to stigma, even in general, pre-COVID, that there are some delays to seeking care, and any delay in seeking care for COVID can certainly have adverse outcomes.
Got it. Thank you. It's, I don't know, I'm in Chicago, so the winter season is upon us. Today we're pretty chilly outside. And we're dealing with the holidays coming upon us as well, which frequently for folks, regardless of a substance use disorder, sometimes the holidays are pretty tough as far as emotions go. And what are you seeing with the winter blues, so to speak? And the hibernation that we're seeing with COVID on top of that, and you mentioned isolation earlier, how much of an impact are we seeing on the opioid epidemic, on different substance use disorders as we go forward?
Yeah, so we know that the pandemic, can be stressful, and that might sound very simple, but I think, fear and anxiety about a new disease and really what's happening around us with, people working from home or losing their jobs, kids in home versus in school quite often. And this can, cause a lot of anxiety and strong emotions. And it can also disrupt sleep and eating patterns. I know for myself, I've had to get up at a regular time each day, try to wear work appropriate clothes and just have that normal routine. Because when you disrupt this, that causes, even more stress and decreases some of your coping mechanisms. I think when you're looking at things like the holidays, it's a time of gathering and reconnecting. For many, the celebrations with Thanksgiving and now with upcoming winter holidays will be different this year. And, we need to have conversations with patients about how they are feeling during the pandemic and winter season and how to build resiliency and coping strategies, knowing that what is our new normal or our current normal to really face these issues. I also think we just need to realize what's going on with this pandemic and the economic toll with layoffs and business closings. We know from prior research that stress related to economic insecurity and unemployment, as well as relationship issues or some of the death or sickness in loved ones, can certainly exacerbate or worsen substance use or other mental health issues.
That's so important. I think we, for all of us, those with substance use disorders, and even those of folks who don't have, giving ourselves the room and the space to feel what we feel and realize that that's okay. May not make sense to us. It might not be logical, but right now it seems that's really important. And I'm right with you on the eating for dealing with stress right now. So I can relate. So along the lines, we work with hospitals and health systems. So as you're doing your work, what is it that hospitals and health systems can do to try to help those patients that they might see for COVID that might have substance use disorders, or patients are seeing for other things they're seeing less often? What can hospitals and health systems do to help out at this difficult time?
I think there's a few things that health systems and providers can do right now during COVID. And one is, particularly when we've got physical distancing or increases in COVID, look for ways to offer virtual face-to-face interactions, to offer, some of that more personalized support. And that allows a lot of patients flexibility, if they've got caregiving responsibilities or other issues at home, to still have that continuity of care. It's also important for healthcare providers to look for these signs of stress and anxiety and to screen patients for substance use disorder and ensure these linkages to care. The earlier we can identify patients who might be having a substance use disorder or that are having mental health issues or other signs of distress, the sooner we can really have that appropriate treatment plan. I also think, as we were talking about stigma earlier, if a patient presents with withdrawal from substances or an overdose or some other issue related to drug use, really to have a non-judgmental conversation with them about their use and work with them to find alternative treatment strategies and offer risk reduction strategies that align with their current needs. I always, when I would see a patient that would disclose a sensitive issue, is thank them, for trusting me to have that conversation with them. And so I think the more open we can be and engage our patients, that really helps with linking to care and ensuring that continuity of treatment.
That's great. And I think the issue of no judgment, how does that enter into things? As clinicians, I'm a nurse. It's been a long time since I've been at the bedside, but I think that always entered into my thinking around, acceptance and people being able to have conversations.
I think that's why, too, looking at ways to look at outpatient prescribing for buprenorphine for treatment of opioid use disorder is so important. I got my waiver a couple of years ago so that I could really extend my practice to see patients in that setting as well. And I think that helps with having those non-judgmental conversations. So depending on if I'm out in public or, if I was in the emergency department or in a clinic, I could tell people it was so important to me that I went through that additional training because I want to see patients at all aspects of the spectrum. So again, I think it's just being able to relate to someone and thanking them again for trusting, trying really not to use stigmatizing words and meeting the patient where they're at, knowing that today might not be the day that there's a behavioral change, but you don't know where they are on that spectrum. Today might be the first day they had that conversation. It might be the 10th time, and it might be that 10th time that causes action. So I always just say, I don't know where I am. I just want to help the patient move along on that spectrum.
That's so important. I think meeting people with what matters to them. We work on age friendly as well, and that is so important in the conversation to make sure that we're getting to the real what matters and what's driving that behavior or the needs that someone might have. So what are some of the best resources that you could recommend that hospitals and health systems can use to drive quality care for those with substance use disorder?
So at CDC, we developed several resources specifically for this. One is our Quality Improvement and Care Coordination resource, which is a really nice framework for primary care providers and healthcare systems to manage patients on long-term opioid therapy. And it has different things in there, like how to do urine drug testing, how do you have some of these conversations, as well as metrics. We also have several training modules at CDC, including addressing the opioid overdose epidemic in the emergency department, which really helps with strategies around prescribing in the emergency department, recognizing the signs of opioid use disorder, and initiating treatment. And of course, the American Hospital Association Opioid Stewardship Implementation Guide offers actionable strategies for hospitals and health systems to implement that promote appropriate use of opioid medications and improve patient outcomes and reduce misuse of opioids.
Thank you for that. I really appreciate those resources, and I'm sure that our participants, those listening to this podcast, will as well. So we've covered some lots of territory today and some really, really important information, and I really appreciate that. Do you have any final thoughts that you'd like to share with the field or those that might be listening in today?
So I think as healthcare providers, it's so important to take that step back and look at patients holistically with that big picture view. And realizing, too, that when you look at risk factors for substance use, it spans from biology to family history of use to socioeconomic status and many other contributing factors. So given this range of risks, when we look at preventing substance use among youth and adolescents before they even engage in starting substances, you must have really a multidisciplinary approach at both the macro level, where we're looking at strengthening environments that youth and adolescents are brought up in, but also individual skills such as resiliency and safe relationships, as these can have long-term impacts. I also just want to, again, highlight that we know that feelings of stress, isolation, hopelessness, and illness are some of the risk factors for suicide. And during this time, it's really critical to continue to enhance factors that are protective in such ways as supporting one another, providing access to clinical care, teaching these coping and problem-solving skills, and really building resiliency in that core capacity. I'd just say in closing, I really encourage providers to consider this big picture holistic approach when identifying and treating their patients and recognizing the many challenges that are escalated by the pandemic.
Hey, Dr. Houry, that's really awesome advice. The holistic approach, of course, we know is so important, but even more so now in paying attention to those signals. So thank you so much for the wonderful information and for sharing your time with us today. We're very, very appreciative, and we look forward to more opportunity to work with you in the future. Thank you.
For more information on substance use disorders and the AHA Opioid Stewardship Implementation Guide, please visit aha.org/AHA STEM the Tide.